It's the year-end flu season, and doctors here are seeing a rise in respiratory infections, some by as much as 20%. As travel picks up and fears climb of a looming COVID wave, Sherlyn Sia finds out that clinics are rushing to ensure that they have enough medication on hand.
Over the last few months, patient visits at Fullerton Health have gone up by 10 to 20%. The healthcare chain has some 30 clinics island-wide. And while they've been seeing a goodly proportion of COVID-19 cases, it's the flu that's rising fast, up almost twofold. Their doctors are now watching out for certain high-risk groups.
Over this last 2 years, especially maybe with the younger children and the elderly, they have not had exposure. So it's kind of your immunity break. And you have not been exposed to flu viruses for a while. And then when you get hit by a flu virus, you may experience more severe symptoms.
Over at Healthway Medical, the group's 50 clinics are seeing occasional spikes in weekly caseloads. And like Fullerton Health, cases are up around 10 to 20% each time. To ensure it's able to meet the increasing year-end demand, the group has been stocking up on medication, especially those for cough, cold and fever.
During the seasonal period, the holiday seasons, we do often see for the past few years increase in influenza, respiratory tract infection cases. So we have sufficient buffers in terms of medications and medical supplies to cope with any increase. Our purchaser may source other forms of medications, and that will help to tide over the period whereby certain other brands may be short.
Flu vaccinations are also high in demand. At Phoenix Medical, there's been a major uptick in people coming forward for their flu shot, around 100 a week. That's compared to just 20 to 30 jabs weekly in previous years. One reason is because of more people travelling this year as borders reopen.
The second would be Ministry's push to encourage some of the higher risk individuals to get their vaccinations done. So this would include for the children under the age of 5 and the elderly above the age of 65, those with chronic ailments.
And to help protect yourself as travel picks up further, doctors are reminding travellers to practice good personal hygiene when overseas and to mask up whenever needed.